Hello, everyone. My name is Fatima,
My name is Joanna.
I'm Jewel. I'm Kitty.
and today we're going to talk about engineering gum tissue as an alternative to palate derived grafts for gingival recession surgery.
We're talking about gingival recession. The gingiva refers to the gums, and the gum tissue disease refers to the recession. If you look at this diagram, you can see as the gums get closer and closer to the oral mucosa, that's where we talk about the recession and the exposure to the root of the tooth. Some of these causes include periodontal diseases, poor hygiene habits, trauma to the gums, and may have genetic influence.
And then for the prevalence of this, it is quite high. It's from the statistics that you can see on the screen. And the cost can also vary depending on the hospital or insurance and so forth. However, the average is $700 to $2,000 per tooth per session. And then for the clinical need, so the gold standard treatment is soft tissue reconstruction through a gum autograft, which comes, so it is the tissue from the palate or roof of the mouth of the patient. And there is no limitations with this on the functionality of the mouth. However, the area that you are harvesting the tissue from is quite small. So that is a big limitation. And also the surgery techniques can be quite complex. And this also prolongs the pain and it has high infection rates. The clinical need, it is in an individualized and customizable tissue reconstruction. There's very small, no site or very small donor site. And then there's also a decreased surgical time and future maintenance cost.
Let's start talking about our approach. So the cells that we're using is cells from our gingival tissues, from our gum tissues, and the cells we're using are keratinocytes, which are the primary type of cells in our epidermis. And then we're also using our fibroblast, which these types of cells are going to be isolated from the balance from the patient through a biopsy. And then for our material, we're using a collagen-based hydrogel because hydrogels, they are hydrophilic, they have high biocompatibility and low toxicity. And we're also using a chemically cross-linked with chenipin, which is a non-cytotoxic effect. And then for our 3D printing type, we're using a direct bioprinting, specifically an inkjet type of printing. And here we have an image that shows the process of how inkjet 3D bioprinting works.
For tissue interfacing, we're utilizing a hydrogel that consists of VP2 or a bone morphogenic protein. We're utilizing this because of the release of inflammatory mediators, so hopefully it'll induce better healing time, as well as more importantly to encourage the adhesion to the bone interfaces that the gum recession site really exposes.
Awesome. So here we have a beautiful diagram that shows our process. So we're getting the cells again from the palate, from the roof of the mouth of the patients, keratinocytes and fibroblast cells. Then we have our collagen-based hydrogel, and that's what makes our bioink synthesis. Then we have our CAD file, which is customizable based on the patient, which then goes through the inkjet 3D bioprinting. And then here we can take a closer look on our device. So again, we can see the tooth with our gingival recession, and then we can see our device on top of it. We have the chenipin, we have our cells, we have the collagen-based hydrogel, and then you can also see the protein, the orange surrounding it. This is our BMP-4 protein.
So the benefits of our product is that it's customizable to the patient and more accurately mimics the architecture of gingival tissue. And it also uses a smaller donor site with the biopsy, meaning that it's a generally faster healing time for the patient, and it's a lot more comfortable of a healing process for the patient. And this product is also makes this surgery significantly easier for periodontists to perform.
And as far as the cost for 3D printing, it is quite a large industry. And as you can see from the statistics on the screen, it will develop and grow in the next 10 years. And as far as non-monetary costs, this autograft takes more time to develop. However, there is no need for a second surgery, which means there is a smaller cost for the patient.
So some of the competition that we have is the autologous tissue graft or the current gold standard. So you have free gingival grafts and connective tissue grafts, which are very similar. In the sense that they make it hard to cut pieces of the palate to fit over the recession area. And because you're taking pieces from the palate, the limited tissue can be used. There's freeze-dried skin allografts for larger recession areas, which have a tendency of graft shrinking during healing, as well as delicate handling, and large structural differences between these grafts and gingival tissue. And then there's the cross-linked collagen fibrous matrix, which even though it's volume stable, it's very porous and can degrade very quickly, and is also very difficult to tailor during surgeries.
This is our presentation and references. Thank you.